We started the football season, which was my junior year at East Burke. Everything was going well. Everything was, healthy wise. Everything was kind of in place. We went to Baptist. I believe it was it would have been probably the first part of October in 1985. Went to Baptist to have basically I had an IVIG, which is basically a treatment that they give you that helps to boost your immune system. Because my transplant was so young, they were giving me medications to boost the immune system to get the cells and stuff to grow a lot at a faster rate, and basically to trick my immune system into thinking that it was a lot healthier than probably what it was. So I was down there for that. Usually when you go to a tertiary center, like a bigger hospital, your blood counts come back within like 10 or 15 minutes. It's nothing that takes very, even back then, it didn't take very long for you to get it back, because they knew that's what people hold their breaths on when you're a child. Whenever you have cancer and stuff, it's your counts. It's when those things come back. So when we had been there, I got my IVIG. I'd been there for like 2 hours, about an hour and a half treatment. And so I'd been there for about 2 hours in the day room, in the day treatment room, and we still hadn't had my counts back. And so I said, we were sitting there, we just wanted to know what my counts were before I left. We asked the nurse, and she calls down to the lab, and within a few minutes, one of my oncologists, pediatric oncologists, is standing in the doorway with tears in his eyes. And then my nurse, Nancy Smith, who basically was standing at the hospital in 1999. She was the very first person I met. She's been like I call her mom, and she calls me her non-biological son, because we've been like that. I've known her for, now it's going on, 24 years since 34 now. I was diagnosed when I was 10. So, going on 24 years, I've known Nancy and her family and things like that. And then she's standing right next to my doctor with tears in her eyes. And what they had determined was that when they did my blood counts, they had immediately sent my blood counts to a pathologist, and the pathologist had noticed, or had basically come to the conclusion that when my transplant was given to me in March, that they think that one of the lymphoma cells hung around and grabbed onto my transplant, and actually I had been diagnosed with leukemia. So I went from having non-Hodgkin's lymphoma twice, because I had the T cell non-Hodgkin's lymphoma twice, and then I guess it was October of '95, they had diagnosed me with acute lymphocytic leukemia. So that was kind of a kick to the stomach, after going through the transplant and stuff like that. And we heard the news immediately. We went home, told mom, or my dad was still at work. Mom and I had gotten home, and I immediately got in my car and drove to school. Like, I didn't want to face my family. I didn't want to do anything. I just wanted to be around my friends. They had just had finished football practice, which I had missed because of being down there for my treatment, and walked in and told the coaches and said, I want to tell you something. I don't want it to be for me. I don't want it to be for my parents, and I don't want you guys to find out separately that they just told me a couple hours ago that I had leukemia. So it's your head's still spinning from that. You're seeing people that are older than you, that they're not supposed to show emotion and stuff. And my coaches, men that were 3 times my age, were bawling in tears. And I'm the one who's the patient, and I'm sitting there consoling them, and like, it'll be okay. It'll be okay. It's nothing that we can't handle. We've handled it before. We'll handle it again. So the next couple of weeks, we were given a couple different options for what we could do, the path that we could take. We were told that one, we could do nothing, which is definitely an option. After you've been through it, the third time, you could do nothing, and you could just allow you'll die from it, and but we just won't torture your body anymore with treatments and stuff like that. The second option was we can give you this new exploratory chemotherapy. We know that your body will become immune to it, and that it only worked for so long, and then you'll end up dying. And then the third option was, well, we have this new type of transplant out here, and it's called the umbilical cord blood stem cell transplant. It's actually the stem cells they pull from the umbilical cord when a baby's born, that they actually end up throwing away. And they said, but we've never given anyone over 80 pounds to have this type of transplant and survive. You're thinking about this is at 8 ounces And at the time, I was 6'3", 185 pounds. I was 100 pounds more than anyone that had ever had that transplant before and survived. So, you know, and not just that, but I had just had a transplant 6 months before. So you're talking about a transplant where your immune system hasn't even built up enough. Can your immune system even go through another transplant? Can it, you know, will you live through the chemotherapy and the radiation that you're going to get? I mean, I was having chemotherapy during the day, but having radiation in the morning, having radiation in the afternoon, puking all day and throwing up and being nauseated and stuff. And I mean, there's all kinds of pictures of just me immediately as soon as stuff's over, just me, just asleep, because I mean, everything was wearing me out. We were given these decisions and basically in no uncertain terms. One of these decisions is what you're going to have to decide. But my parents were, no matter what you decide, we're behind you, no matter whether it's to live, whether it's just to kind of stop doing it. And so, that there was very much a struggle. I mean, it was a struggle to decide that. I remember going to school one day, and I went to school as a visitor, not as a student. I told him, I went into the principal's office and I said, "Hey, I'm not here as a student today. I'm here to see my friends, and this is why." So one of my teachers was very nice to let me walk into the classroom where my friends were. And so I stood in front of my friends and told them what was going on. Well, I mean, of course, there's not a dry eye in the classroom and stuff. And because I always kind of joked about it and stuff to try to, make my friends not maybe as light of the situation, but just, I always felt that humor was a way to get through things. So, I went and got them all, tissue paper and brought it down to them and stuff like that. And we're like, "Hey, it's okay if you want to cry. I've already cried my time." It's just all trying to make them feel better about the situation. But I told them about the three options I was given. And I allowed them to help me make the decision, because they were as important to me as my parents were, as my doctors were and stuff like that, because they were the people that whenever I was in school during the day, that was my family. They were always the ones that looked out for me and stuff like that, no matter what was going on, all because of the history that I'd had with them, because they had all grown up with me going through all these things. So, we decided to, hey, let's do the transplant. Let's not give up on things. My body's always reacted. It's always, it's always come back from all these things. We've never really experienced anything negative other than just the cancers. I mean, but no residual effects or anything like that was an issue. So we go through we call the doctors and we're like, "Hey, we're going to do this." So we actually end up doing the experimental chemotherapy, which of course my body would become immune to, but it's just kind of the prelims to the more chemo and more radiation.